My name is Dan, and I'd like to tell you about my story as a cancer fighter. Now, to go back a little bit, I want to show you some of the hats that I wear or have worn. First of all, I was in the Army for 20 years, and I wore armor hats, and I was an aviator, so I flew a lot of times. I retired from the Army, and then I became a teacher. And I taught for 20 years as a teacher, and I was a coach of many sports. And then I retired as a teacher, but I wanted to stay busy. So I substituted. I substituted for 10 more years. And during that time, I found out that I had bladder cancer. And so I wanted to stay busy. So as I did, I joined the Disabled American Veterans, where I was a commander and a senior vice commander. And I joined the Sons of the American Revolution, where I go and to present demonstrations, my traveling trunk to fourth graders at different elementary schools. And I got involved with our church, and I work a lot over the church, a lot. And then I play Santa Claus for the kids in December. In the meantime, I work out in my yard with my wife, doing the things that she tells me to do. And I was also a member of an organization called Paz Amigos, where we helped immigrants who got released from the detention center get to their destination. And I wore my little Paz Amigo hats. So many hats. And what I'm trying to say is that I tried to stay busy, even though I was found out that I had bladder cancer. I just don't believe in just sitting around and moping about it. When I found out that I had blood in my urine back in April of 2019, I immediately called my family doctor and went to see him. And he says, I need to send you to a urologist. So I went to the urologist, and he says, okay, let's do some checks. And he did. And he said, I need to take that out. And so he went ahead and he scraped out the tumors that were in my bladder. And then he says, I think what I need to do is send you up to the Cancer Treatment Center in Noonan to see another urologist. So within a couple of days, I got sent up there. And that urologist says, I need to scrape out and see for myself. So I had another operation. Oh boy. But when you hear the word cancer, the big C word, some people think it's scary. I don't like to look at things as scary or afraid. I look at it as this is a target, an objective that I got to get through. And with my wife, talking with her to help, and I've had a lot of confidence in my doctors, the urologist up in Noonan. He and the team, the nursing team, they talked me through everything. They made me feel very comfortable. And one of the nurses, Kendra, who helped me and went through with everything, I wrote her up for a Daisy Award, and she got it. She got the Daisy Award. So with all of this, I went through a lot of treatments. It seemed like we were going up there, and we were. Starting in May of 2019, I was going up there every week to have what they call a BCG treatment. And that, if you don't know, is when I didn't know, and they said they were going to put weakened tuberculosis bacteria in my bladder. And I said, how are they going to do that? And they said, how do you think? And so, well, that was interesting. And it was a little apprehensive to see what they were going to do when you pull out that big long tube and all the other stuff. And so anyway, got in there. And after a while, I was kind of instructing the nurses on what to do. We were joking about it and everything. And so it wasn't that bad. It wasn't that bad, but we were seeing them every week, 1 week apart. We'll go in there to check it out. And my urologist, Dr. Shelfo, he was extraordinary. He came in and he just checked. pretty soon it got to be where he says, I don't need you to come in every week. Let's move it to 3 months at a time. I said, okay. So that allowed me to go on vacations and so forth. And I enjoyed it. And I kind of anticipated wanting to go up there again and see the nurses that I met and the doctors. And so we go in, he said, we're going to do another cystoscope. And that, when I first had one a long time ago, when it first started, it was like, wait a minute, you're going to do what? And so anyway, it's, you got to trust your doctor. You got to trust your doctor, and you got to have a positive attitude. And I just wanted to make sure that everybody knows that when you first see a sign that is not normal, you need to get to the doctor and let them check it out, because they are experienced and they know what to do. The blood in the urine, that set off some signals for the doctor to look at. And then after seeing Dr. Shelfo up there, after 3 months, a cystoscope, maybe another BCG or so, he says, all right, come back in 6 months. And so I came back, and right now I'm on the 6 month cycle. And we got another trip coming up to go up there. And if he says he likes what he sees, he may put me on coming another year in a year. I said, how long do I have to do this? He said, for the rest of your life. I said, no, you're not leaving, are you? He says, no. So I want to keep the same doctor. And I even made sure I didn't get the Medicare supplements with all the wonderful things. I wanted to stay Dr. Shelfo. But 6 months at a time, open for a year at a time. My main message is stay busy. Notify the doctors at the first opportunity that you see something that's not right, get it checked out. And they caught it. And I'm so thankful that happened. And so that's my story. I hope you enjoy it. Thank you.